All right. Well, hi everyone. I'm Dr. Laurie McCauley. If you don't know me, I have been a veterinarian since 1992, a very long time. I um, started the first rehab clinic, designed the first underwater treadmill, taught the rehab certification course for 14 years as one of the main instructors. Um, Became board certified about a decade ago in sports medicine and rehabilitation. And as you'll see, I love to teach. So I am doing this lecture for you guys, SAENA, and we did invite some other people to come in. So if you don't know anything about SAENA or SAENA, it's a small animal and equine neuropathic association, naturopathic. It's people from New Zealand and Australia who work with veterinary in the veterinary industry to help dogs and cats and horses, and we all worked together. If you have more interest in Sienna, then we've got the website right here, www.saena.com.au, and the contact information info@saena.com.au. So feel free to drop them a line and learn more about it. It's very cool. All right. We're going to start. My company is Optimum Pet Vitality. It's a teaching platform, and I love to teach. We have courses right now for both professionals and pet parents. For professionals and pet parents, we have Tuning Into Your Dog, which is about using acoustic therapy, in specific a tuning fork, to do amazing things like getting rid of trigger points and increasing lymphatics and getting rid of pain. We have a course on cranial cruciate, actually two courses on cranial cruciate disease. And then for both pet parents and professionals, one of each, we have a laser course. So professionals, optimum laser therapy, pet parents, at-home laser therapy. We just relaunched our exercise course as Confident Canine Care Masterclass and Exercise Therapy for Every Practice is our professionals. We have Core and More for our pet parents. We have a fascia class, the Forgotten Organ, a Fascia 101, the Forgotten Organ, and then for our pet parents, Fascinating Fascia. I always like to thank our sponsors. We have Companion, SpectraVet, Standard Process, Avant, Respond, BioPup, Myos, and Jope. So all great products. I handpicked them myself. Let's talk geriatrics. So this is part one. So part one will be more about what is geriatrics, what's going on in their body. Part two will be a combination of what it is to finish that up. We want to make these short so you guys didn't have any stress about listening to something long, and then how to fix it. And then part three will be all about things that we can do to help our older pets be young. So the first thing you have to understand is, what is an older pet? I like to remember things in an easy fashion. So we have, by definition, giant dogs at 7.5, large dogs 8.9, medium dogs at 10.2, and small dogs at 11.5. I remember it by, you start giant dog at 8 and just go 8, 9, 10, 11. And it doesn't matter about the decimal. So remember, big dogs don't live as long, small dogs live longer on average. AVMA report that says that about 30% of dogs are 6 to 10 years of age, so there's a lot of them, and 14% are over 10 years. And I will watch the chat, so if anyone has questions, feel free to let me know. A word you need to know, senescence. Senescence is what happens in the body, the whole body, as we age. This is human as well as animal. So each organ system decreases function and starts to degrade. We become more susceptible to disease because our bodies can't fight. Our immune systems drop, and I should say our pets' bodies have decreased ability to deal with stress. We have more ROS, or reactive oxygen species, which is when we talk about oxidative damage to the tissues, and that can be muscle, that can be heart, it can be everything. We also have decreased ATP, which is the energy of the cell. So the cells that we have less cells of them. You'll see this in multiple cases. And the cells that we have actually can't make as much energy to do what they need to do. And we have more apoptosis, which is natural cell death when they contract, and less cell differentiation. So we have less good cells and a lot more of them die. We make less of them and more die. So that's like physiology. Bigger picture, what do we see? We see obesity, right? Metabolism slows down. We see more neoplasia, DJD or degenerative joint disease, more arthritis. We have loss of sensory acuity, right? Hearing and vision, and more pain-related issues, which is a big one that we want to definitely help get rid of. So muscle system, we see loss of both strength and endurance, and this is going to be one of the ways that we can help our kids. We have orthopedic issues. We have neurological conditions. We're going to talk a lot more. I'm going to show you some really cool MRI vision or pictures of the brain. So we lose cognition and proprioception. We also have degeneration in the internal organs. So we may see more liver disease and kidney disease and lung disease and heart disease and all of that. I thought this was fascinating when I found this. And I put I'm a research nerd, so I actually put the research link in here. The College of Family Physicians of Canada has it as their part of their statement that this is in humans, if no trauma, moderate exercise does not lead to the acceleration of stifle osteoarthritis with or without pre-existing disease, which means unless you're recovering at the time from a trauma, moderate exercise is a wonderful thing. It is not going to increase arthritis. They also show that the exercise improved physical function and reduced pain and disability. And they actually say they consider it an underutilized form of pain control for osteoarthritis. It's a wonderful thing if we can do this for our dogs. Another word you need to know, sarcopenia, right? Penia means less, sarco like sarcomeres. So our muscle fibers, literally, the fibers, remember, each muscle fiber is a cell, one cell, so it can be a long cell. They get replaced first with fat. So what we see as our pets age is they may not lose circumference, but they lose strength. Then as they continue to get older, those fibers actually get replaced with fibrous tissue. Think of like scar tissue. And then we lose circumference and more strength. So if you think about, like, I don't know if you guys know Arnold Schwarzenegger, he's one of those big, like, tough guys. As he's aged, he has shrunken, not because he's not still working out, but because it's a natural age change and there's only so much you can do. And we're going to show you some ways to slow that down. Just from aging, we have increased stiffness. Why? Because we have less blood going to the muscles, which means there's less oxygen going to the muscles, the muscle fibers, so they can't do what they need to do, which is both contract and relax. And it's not just the muscle, but both tendons and ligaments also atrophy just with age. So we lose collagen in our tendons and ligaments. So what does that mean for the dog? It means that the support structures of the joints, the tendons, the ligaments, the joint capsule, all of that, as it loses collagen, literally they lose support. So they have more laxity in their joints. What's going on inside the joints? If we have more laxity, we have more inflammation, and we have chondrocytes, which is 20% of our cartilage, right? 80% is matrix. Those chondrocytes that are making that matrix that prevent us from having arthritis, we lose them in number. And if we give them growth factors to say, hey guys, come on, let's go, we actually they lose their ability to respond to the growth factors. So just with age, we decrease the number of cartilage cells and the amount of growth factors and the ability of the cells to respond to the growth factors to help heal the joint. So left alone, what we see is The dogs. I don't feel good, so I'm less active. I'm less active, so I atrophy muscle, tendon, ligament. I atrophy, so I'm more unstable. I'm more unstable, so I hurt more, so I lay down. Our goal, my goal, and what I hope is your goal, is to say, hey, dude, let's go. We're going to feel better. So we feel better. We're more active. We're more active. So we increase muscle, tendon, ligament strength, where we build strength. So we're more stable. We're more stable. We feel better. We're going to be more active and have improved quality of life. Now, one of the things you need to know is that it's different for muscle versus tendon and ligament, right? Muscle has a lot more blood flow. It's faster to get strong. So it takes 3 to 4 weeks of consistent exercise to show physiologic change in the muscle. It takes 3 to 4 months to get a physiologic change in tendons and ligaments. The other thing I want you to hear here is with inactivity, tendons and ligaments atrophy. And with activity, we can actually get them to hypertrophy, which is decreasing the chance of cranial cruciate tear, decreasing the chance of medial shoulder instability. All of these things are super important. Until about maybe a year and a half ago, when we looked at the literature, it said that you can build strength as the animal gets old by concentric, but not eccentric exercise. In the last year and a half, we've research that showed that you can use slow and controlled eccentric exercise to help geriatric patients. So our eccentric exercise we can use, we just have to use it appropriately. So I don't know how much you guys know, so I'm going to go through definitions and I ask you to come through them with me. So even if you're seeing this as a replay, I want you to play along. So I want you to take your drink, something, a book, something in your hand, and put your shoulder, let's see if you can do this, right? Put it out that way. Now, if you come up and you use your biceps as you lift something up, that is a concentric exercise. You are shortening the muscle as you do that. When you bring it down slowly, that is an eccentric exercise. It is contracting and lengthening at the same time. This is a much harder exercise and done inappropriately, more likely to cause damage. So you have to be careful with it. And when used appropriately, build strength significantly faster. So we just learned about concentric exercise, shortening the muscle to get it to get stronger. Eccentric exercise, which is lengthening the muscle to get it stronger. And then you have isometric exercise. Iso means same, metric means length. So you think about, well, how am I using the muscle if it's staying the same length? If you have any questions, do a plank, right? It's like a push-up without pushing up. You just hold it. And you can say, okay, this is easy. And then you do it for 1 minute, and then 3 minutes, and then 5 minutes, and you'll be like, oh, this is what she means. So it's the safest and the least likely to cause any problems, and great for a starting place for our older dogs. Muscle is not changing length, and it's strengthening. Again, from some research, some of the things we can do to slow down sarcopenia. Underwater treadmill is great. Balance board exercise. I mean, we're going to talk about that later. Limb weighting, so increasing weight to a limb. You don't have to use weights. There's other ways to do it. And then isometric exercises. These are what I usually start my geriatric patients with. Human study. I love the research. 4 to 5 weeks of bed rest decrease muscle mass by 10%. So being stuck in a bed significantly decreases muscle mass by standing, only standing 10 minutes a day, not even doing squats or walking or anything else. It decreased the atrophy by 25%. Moving is super, super important. You say, okay, well, what about a dog study? With cage rest, what they found was that the dogs had significant atrophy of the tibia, especially where it inserts with the collateral ligaments. So if you don't know, the medial and lateral collateral ligaments on the ligaments on the sides of most of our joints that help prevent side-to-side instability. Aging also decreases the tensile strength of the ligaments. So again, if we have rest and we have aging combined, we're going to lose strength and stability significantly faster. So we can't change aging, we can change movement. Fun bone facts. Animals change bone every 5 years. You're like, what? Yep. So you remember we have osteoclasts that chunk, 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 eat the bone, and osteoblasts who lay it down, so that we're always taking some bone away and putting some bone back. That's how our body controls our calcium, right? Every 5 years, you have all new bone, which is really cool. So we can make definite changes in all of our animals. Also, they've shown that a lifetime of weight-bearing exercise significantly decreases bone loss seen with aging. That's good. And weight training before a bone fracture significantly decreases healing time. So in other words, if you're a runner and you break a bone, you're going to heal significantly faster, right? Same with our dogs. If they're couch potatoes and they break a bone, the healing time is significantly longer than if you take them for walks all the time. In animals, or at least dogs, we don't see osteoporosis, and the bones definitely become more brittle. Why? Because we have fat coming into the bone marrow, and the walls of the bone get thinner. As we age, the dogs, if they fracture a bone, is going to heal slower, and it takes longer to form a callus. Obesity also plays a part in that. If you have a pet that is obese, their bones are actually become more brittle, and we see more osteoarthritis. Musculoskeletal changes. Let's think of cartilage, right? So with cartilage, one of the things we see is the water content significantly decreases. A wet tissue is a happy tissue. A dry tissue is more brittle. So when we decrease water in the cartilage, we actually see the layer of cartilage thin out. As we age, the dogs age, the chondrocytes, the cells that make the cartilage, make smaller pieces. It's not as uniform. So instead of these nice bottle brush aggregans, we get little bits of pieces all over. And we have less squish, which means we're going to have more inflammation because we don't have even squish or load on the joints. We have less mitotic activity, meaning that the cells don't reproduce as fast. So we have less cells. We have decreased response to the growth factors and to mechanical stimulates. So in other words, if you go running and there's pressure on your joints, on your cartilage, that cartilage is turned on to produce more cartilage, right? So that is a great thing for our older animals. Not that they should run so much that they have problems, but that kind of movement is going to help that cartilage rebuild. And it's not going to make it rebuild as fast as if they were younger. So one of the things we see is increased eburnation, right? So where the cartilage literally gets worn away. Oops. We see more degenerative lumbosacral stenosis. So here's our lumbar spine, here's our sacrum, right? Here's a dog, the ears are going this way, tail's going to come out this way. L7, sacrum, we get a we have stenosis, so we have thinning or narrowing of the spinal canal. So remember our last spinal nerves, our spinal cord only goes to L4-5, and after that we have our cauda equina. So the little nerves like a horsetail come down, and the space for the last nerves to come out gets narrowed. So it pinches on the nerves as they come out. So we can see things like trouble with extension. So going up the stairs or putting their front feet on something. Um, Problems if it's painful if you pick the tail up because it's going to put pressure right in here. You can see fecal urinary incontinence. And who do we see this in? We see it in our large working dogs, especially our German Shepherds. Lactic acid builds up faster, so we have more stiffness. Now, remember, dogs build pyruvate way more than lactic acid. So that's why dogs can do things like run the Iditarod, is because the lactic acid pops into pyruvate, but it still can cause stiffness. Glycogen depletes faster, so we have loss of strength. So, right, glycogen is one of the things we use, our muscles use to be able to have energy. We have decreased creatinine phosphate. So remember, the body, the muscle says, okay, we need to work. So we're going to use up all of our creatinine phosphate, which is maybe the first 5 to 30 seconds. Then we use up our glycogen, and then we use up our fat. So we're going to have less creatinine phosphate, and we're going to have less glycogen. So we can't, no matter how much we work out, we can't build muscle as fast as young dogs, but we can certainly improve what we have. So I can see if there's anything. Nope. Okay. Muscle capillarization decreases with age. What does that mean? So we have capillaries, right? So we have our little blood vessels that come to each muscle cell, which is one muscle fiber. And in some people or dogs, you may have one capillary that goes to 1, 5, 20, 100 different muscle cells. In an elite athlete, you may actually have 4 capillaries going to each cell, which is amazing, right? That the cell gets all this oxygen, all these great chemicals being released into it. It can do everything it needs to do. Just with age, capillaries decrease, right? They get pulled back, they disappear. So you have less blood flow and less oxygen to the muscles. So just from aging, we have decreased endurance. There's type 1 and type 2 muscle fibers. So our type 1 muscle fibers, that's our endurance and our postural muscles. So the things that keep us upright, right? So think about like a marathon runner. They're very lean and they can go forever. That's because they have worked their type 1 muscle fibers significantly, and those are super strong. Our type 2 muscle fibers are the ones that contract really hard. It's our strength, right? And that's our gym rats. So the people or animals who are big muscle and they tire out faster, which is why so many people do like CrossFit, or even our canine athletes do different kinds of exercise to build both type 1 and type 2. Why do you need to know that? Because just from aging, our dogs decrease up to 25% of their type 2 muscle fibers. And not affected is the type 1, except that if they are laying around, that's what drops the type 1 muscle fibers. So they decrease by disuse atrophy, right? So I'm not using them, I lose them. So if you have a dog who's getting older and laying around, our sarcopenia happens much, much faster. We see neurological changes, changes in coordination, proprioception, right? So where is my body in space? Our muscle strength declines, so we may have ataxia in humans. It's huge, right? We talk about a fall risk because of these changes. Our vision helps us understand where our body is in space. And if you don't believe me, I would have you say, I can't see you, so you can do this without me knowing. Stand on one foot and close your eyes. And you may start to wobble much faster than if your eyes were open. Why? Because your vision helps your brain tell you where you are in space. And we can increase that acuity so that our animals and people can improve their proprioception and balance to fight the changes. It's still going to happen, but it'll happen much slower, and we can make it go the other way for a while so that they have less problems as they age. Muscle spindle cells. These are these little cells between the muscle fibers. So here's our muscle fibers, those are our muscle cells, and those are the ones that have lots of nerves going up to and back to, up to the brain and back from the brain that tell the body where the dog's body is in space. Just from getting older, we have less of those cells. Just from getting older, the nerves that go from those cells up to the brain and back, they lose their myelin. So you have less cells and you have less neurological input up to the brain and back to the muscle to say this is what you need to do. Sensory changes. We have loss of vision. So you may see cataracts, right? So you may see cataracts. You may have luxation of the lens. You can have KCS, keratoconjunctivitis sicca, or dry eye. You can have more trauma. You may have seen things like Halo, which is a device like a little backpack with a loop so that if the dogs go blind, they can bump into something that tells their back what's going on rather than their eyes so they don't get corneal ulcers. We can have degeneration or detachment of the retina. We have loss of hearing just from getting older. Big thing. We see this more and more, cognitive changes. Why? We have increased oxidative stress, right? More damage to the brain just from getting older. We get increased beta amyloid plaques, like in humans that have Alzheimer's. We see it in dogs too. We have DNA fragmentation or damage. So the DNA in the cells in the brain isn't what it should be, right? We have less of it, and what we have is not functioning to the best of its ability. And we have changes in intracellular signaling. So our cytokines, the chemicals that talk from one cell to the next cell, they're miscommunication, almost like they're changing languages. I love, love, love these images, right? Young dog brain, same slice, old dog brain. What do you see that's different? I'll give you a second. Do 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 do. I don't know if you guys are old enough, or even if that TV show was in Australia or New Zealand. But when we look at it, young dog brain, look at the difference between the white and gray matter, right? Not so much here. Look at the sulcuses here. So the shape of the brain, it's a little bit different here. We have less brain matter. We have, here's our ventricles. They're small. You say ventricles. Oh yeah. The ventricles, like ventricles of the heart, is what makes CSF, cerebral spinal fluid, and then pumps it down through the dura mater to bathe the spinal cord. It's really big here. Is that good? No, it's not. It means there's a lot less brain tissue because there's more space for that fluid. And then when we look at the actual sections of the brain, this right here, this big guy right here, he's beautiful. That's the hippocampus. That's the part of the brain that does memory and learning. Just from aging, it gets significantly smaller. So let's talk about cognitive dysfunction for a minute. It is a progressive, keeps going, neurodegenerative disorder. Some of the signs we see changes in sleeping habits. Some of your patients may be getting up at 3 in the morning and pacing and pacing and pacing. They may be howling or just not comfortable going to sleep, rolling and rolling. We see lack of environmental recognition. When my old golden retriever was like 14, he would go to the wrong side of the door. I'm like, dude, the door handle's over here. You've been using this door for the last 10 years. Don't you remember? No, he didn't. We have decreased interaction with humans and animal family, right? So this is when you come home and the dog used to run up and say, hi, Mom, how you doing? And now he's still sleeping in the corner. Or he kind of picks his head up and goes, yeah, okay, you're there. Right? We want them to be part of the family and enjoy life. See, restlessness, apathy, right? You're like, hey, dude, do you want to go for a walk? And no, maybe not. That's not good. We want better quality of life. You may see more anxiety. Oh my God, Mom's leaving. Oh my God, what am I going to do? just because they're getting older. They may have an altered appetite. It may be, oh my God, I'm starving, or I'm a little more picky. I don't know if I want that food. They may become more irritable or aggressive. It may be cognitive or it may be pain, and you have to figure that out. Changes in vocalization, either less barky or vocal or more barky or vocal. And the one that's kind of scary, incontinence, right? Both fecal or urinary, just from getting older. All right, that's what I have for tonight. Got a lot more, but we wanted to keep this to about 30 minutes. So we have it as a part 2 and part 3. We'll go through. Do I have any questions? At this point, people can go ahead and unmute themselves if they have questions. You can pop something in the chat. There we go. Now I can see my chat. Anybody have any questions?
Hi, Laurie. I don't have a question, but I'd just like to say on behalf of SAENA students and practitioners, thanks for that first webinar tonight, or for us today. It's been really educational for us as well, and refresher as well. So we're looking forward to the next one as well. So thank you.
Awesome. All right. Well, then I hope you guys had fun. I hope you learned something, and we will send you the replay. So if there's anybody who missed it and they want to watch it, they can. And I'll see you guys in a couple months.